Hey everyone, it's Dr. Rick, founder of Herbal 411. It's tough to maintain lifestyle change, especially when I implement it with you. There's always going to be that little honeymoon phase where you're really psyched up and excited, and that dopamine hit that you get when we meet virtually and we start planning, it's kind of exciting. It'll carry you through about 2 to 3 weeks. And then depression hits. No, actually, things get in the way, and unfortunately with being a parent or owning a business or being an employee or having a medical disease, it might fade, meaning the dopamine hit and the motivation. So I like to consider designing anchor events like this. I'm at University of Utah, and there's a 5K that I'm running at elevation. But it's an anchoring event for the last 6 weeks as far as I had to obligate myself to training. Otherwise, if I do this is a 3.2 mile run. I didn't train, it would be a painful run. And it's $35, so it does give me some reason to continue training, even with the weather change in Chicago. The options that you might have would be a CrossFit game if you're a HIIT trainer, going on vacation somewhere wearing bathing suits, or a skiing event, or visiting old friends in a class reunion. All these things will motivate persistence. It's great to have that goal, but what happens during the 12 months? I think that might get you motivated to stay on target, because I'll be doing blood tests, I'll be checking your blood pressures, and if you don't stay the course, we're going to find problems. We'll have to replan everything and get harder into what I need you to do. So having a daisy chain of anchoring events would be important. As far as you guys running or lifting or hitting a 1 rep max, that's totally up to the planning stages, and that's what I like to do as far as motivating you to move forward. Whether you have osteoporosis or whether you have an elevated cholesterol, whether you're going for a procedure, all these things are kind of threats. Threat incentive does work, but like when you go see a doctor and he says, okay, your cholesterol is high, we'll repeat your blood tests in 6 to 12 months, and if it's still elevated, you're getting on a statin. That's a typical thing. Or your blood pressure, or your glucose. I think the threat loses its steam after about 2 to 3 weeks. So I don't like waiting for a whole year, and I think that wellness exams on insurance are only covered once a year, I should say. And then after that, it's like, okay, well, if I don't have my visit paid for, I'm not going to go, which is demotivating. But I would think outside the box of contemporary insurance-based allowance and try to get into the box of you have to do this to decrease the chances of disease popping up and also increase the chances of you being in the longevity camp that I'm trying to get to. So it's always going to be difficult if you wait till retirement years, especially if you're an average overweight person. 1/3 of America is overweight, and with the overweight comes diabetes and the joint pain and the shortness of breath, the sedentary life, all those things. So we don't want to wait until you declare like 3 different diseases and have 4 different medicines. Daisy chain those anchoring events, and maybe it'll motivate you to consider designing your own anchoring event. If you don't have a doctor that will help plan, then you might have to find a physical therapist, a personal trainer, a yoga instructor, a counselor, maybe a friend or a group to join up with and design your anchoring event. But bottom line is, don't just wait till your next doctor visit to hope and keep your fingers crossed that the test is going to turn negative. Be proactive and try to have fun about it. So hopefully this gives you a couple of ideas. If you have somebody in your family that is a little bit demotivated, send them this video, and hopefully we'll be able to have a community of healthy together. Thanks for watching, and stay healthy.